Hi everybody, my name is Rachel Bodie and I am in the MSN-FNP program at Franklin University. Today I'll be completing a discussion video for an assignment for pharmacology, advanced pharmacology. In this assignment I'll be doing some patient education to relay and teach a patient about a new medication. So my patient is going to be prescribed furosemide, also called Lasix. My patient has a diagnosis of congestive heart failure and has been noticed some increased swelling in her feet and ankles. At this visit, we determined it was time to start doing something about her fluid retention, as it's becoming difficult for her to wear her shoes. This medicine is part of a family known as water pills. It will help decrease the amount of fluid in your body by making you pee more. The increased need to pee will help decrease the amount of fluid in your body. The increased fluid is what's causing your feet and ankles to swell. Once this pill is taken by mouth, it's absorbed into your intestines, broken down in your liver, and eliminated from your body via your urine. Approximately 30 to 60 minutes, so an hour or so after you take the medication, you'll notice that you're peeing more. And you may notice that lasts for the first 2 hours after taking the medication. And then the need to pee might slow again. Many people find the increased need to void and urinate a very unpleasant result of this medication, but it is also its intended purpose, to get some of that fluid out of your body via your urine. It is important to take this medication to minimize having to get up in the middle of the night to pee. So when you take your second dose, it's important to take it before 5 p.m. So take it before supper, 5 p.m., to avoid having to get up in the middle of the night to pee. Other potential side effects of this medication include dizziness, low blood pressure, rash and itchiness. You may develop a ringing in your ear, upset stomach, muscle cramps. You also may notice that when you go out in the sun, you burn more easily now that you're taking this medication. It's really important that you utilize proper sun protection and sunscreen when out in the sun to minimize your chances of developing a bad sunburn. I have looked through a list of your current medications, including your up-to-date vitamins, herbs, and over-the-counters. There are a few drugs that you do take currently that will increase your risk of developing some side effects. I notice you take metoprolol. Adding a water pill like furosemide will increase your risk of developing low blood pressure. Be sure to monitor for signs of low blood pressure, which include feeling dizzy and faint, having blurred vision, or just being very, very tired. You also mentioned that you take ibuprofen for back pain, as needed. Ibuprofen does not let this medication work as well as it should. So if possible, try using Tylenol instead of ibuprofen for your back pain. It will be very important for you to notify a provider if you become pregnant. This drug will make babies grow larger when developing in the uterus. This medication may not be the best choice for you if you have a liver problem or are diabetic, because it can cause jaundice and increase blood sugars in those with diabetes. Furosemide can be given to children from newborn neonates all the way up to the elderly at various risk-benefit ratios. So in babies and in children, it's giving on a weight-based dose. The use of furosemide in pediatrics can increase the risk of kidney stones and heart defects in babies that are born prematurely. The elderly have an increased risk of all the side effects associated with furosemide. And most commonly, furosemide will increase risk of falls in the elderly due to the increased risk of developing low blood pressure resulting in dizziness, which will result in a fall. So the key points that I want to relay to you: weigh yourself daily on the same scale at the same time of the day, preferably without clothing on and right after you urinate in the morning. If you gain more than 3 pounds in 24 hours, please contact me. To minimize dizziness when taking furosemide, change positions slowly. Try to avoid standing for long periods and making rapid movements from sitting to standing. Eat a diet high in potassium, such as bananas, cantaloupe, raisins, spinach, peas, cucumbers. I'll send you home with a list of things that are high in potassium. Furosemide eliminates some of the potassium from your body, so it's important to replenish that. Utilize sunscreen and sun protection to avoid a severe sunburn. Seek medical attention immediately if you develop a rash, muscle weakness, tingling in your arms or your legs, cramps, nausea, vomiting, as these may all lead to potential dangerous complications. If you are diabetic or develop diabetes, monitor your blood sugars closely. Furosemide will increase blood sugars. It is important to see me for follow-up care, laboratory testing for disease management, and medication management. Doses may need to be altered and changed, and medications may need to be altered and changed based on disease progression and lab results. Remember to take your second dose of furosemide before 5 p.m. to minimize the number of times you have to get up in the night to pee. It's important. I want you to get a good night's rest. If you miss a dose, take it as soon as you remember, unless it's within 2 hours of your next dose. Don't double up on your doses. So I just want to make sure I gave you a lot of information, and to make sure that I explained things correctly, I would like you to please tell me, why will you be taking this medication? Can you explain to me what this medication will do? Perfect. And then what are 3 things to monitor for while you're taking this medication? Excellent. I like to utilize Teach Back whenever I do any sort of education, whether it be medication, disease management, and it's always really important when I do Teach Back to not make it feel like a pop quiz on the patient. We want to make sure that to make sure I explained it correctly, or to make it seem, how did I explain it so that you understand, to take the pressure off the patient and to be able to find any gaps in what you need to re-explain, or maybe explain a little better to the patient. And that's just a good last closing there, to be able to see what the patient retained from your conversation and education, and what you need to re-go over. And then that's a great time to go over things again and just kind of hit those high points. Definitely always send home a paper copy of patient education. You can splur off as much education as you want, but when they get home, they're going to want that paper copy so they can, okay, yep, that's what she said. Feel free to write notes on that patient education. I find it really helpful when I'm explaining any disease processes to patients that I draw pictures. So my patients, when I send them home with their after-visit summaries, they usually have pictures on them, because I'm a picture person. I like seeing visual things, and I feel like that will help my patients as well. So every patient's different. Every patient learns different. You just got to figure out what's going to work well for that patient. And I'm a firm believer in Teach Back, and being able to figure out how to best get your patient to understand and be a health advocate for themselves with the new medication or disease process. I thank you very much for listening to my discussion 2 post for advanced pharmacology, and I will see you all next week. Thank you.